here on Ward B3, which is one of the wards in the hospital that treats bowel cancer patients. And the reason we've chosen to come here is that we're celebrating some national audit information that's come out that actually places us as one of the very best hospitals in the country for patients undergoing bowel cancer. That's because of initiatives such as the Early Enhanced Recovery service that we offer to patients and the technical superiority of our surgeons and the general care that we're actually giving our patients. So it's a great pleasure to be here on Ward B3. We treat about 200 bowel cancer patients, complex cases, every year. And in terms of their outcomes, they are twice as likely to survive if they've had their operation in Stepping Hill than elsewhere in Greater Manchester. Something to celebrate and something which I'm sure our patients are really pleased to hear about. So thank you to all of the team involved in that area. Although it's an internal programme of work, I thought you might be interested to hear about a programme of work called Building a Sustainable Future. And that's about how over the next 3 years and beyond we create the right kind of working environment, the right kind of processes and procedures to make us one of the very most efficient organisations. We started this off with a big meeting of well over 100 managers and clinicians who between them came up with 600 different ideas on how we could help ourselves to build that sustainable future. Those have now been turned into major work streams, and there's one that's very close to my heart because I'm the executive lead on it, and that's around engagement and culture. Because unless we actually get that right, underpinning everything else, we're not going to have staff wanting to make the difficult challenges to ensure that we are as efficient and effective, high quality as we possibly can be. One of the reasons we want to build a sustainable future is that we need to ensure that every year we actually make sufficient monies to be able to invest in those developments that are important to the organisation. Two of those are the Macmillan Fund, where they've identified that they will fundraise for us £2.5 million to create an integrated cancer service centre here. And we would have to match that funding and help to develop cancer services to an even greater extent here. Very much with Macmillan looking at information needs and support to patients who are living with cancer. We also have a significant development that we want to occur in the next year, which will build extra operating theatre capacity, but will also refurbish our wards. Some of our wards are very elderly. We keep them in as good a condition as we possibly can, but the cost of doing that is significant. They're also not necessarily always the easiest for our staff to work in, and so these brand new wards will allow us to knock down some of the old wards, but to give not only the very best care, but the very best environment to our patients and to the staff. And finally, some developments that I hope will help with giving good information to patients. What we're doing is we're placing 22 plasma screens around the organisation, mainly in reception areas, outpatient waiting areas. That's going to be able to give patients up-to-date information about the organisation, about initiatives and about the department itself. So waiting times or particular specialties will be included. It's a real partnership that we've got between the comms team and the operational departments throughout the organisation, and it's all been funded solely through sponsorship, which makes this an initiative which only adds a plus across all of the boxes that we need to tick. And finally, something that I hope will be useful for both our patients and our staff is free Wi-Fi access. That's going to go live in the next couple of weeks in all of our public areas, and I hope that that will be a real help to people who now have smartphones, tablets and other ways of communicating, and will make it a really beneficial site for people maybe to come and have a cup of coffee while they're waiting for a test result. So I hope that that is a continuation of our listening to patients and staff for their needs. Thank you.